with 100 more ICU beds ready by next week, an expert tells us if there will be that many COVID-19 patients needing intensive care. Planning to buy a house in a prime location? Some key measures under a new public housing model that you need to take note of. And Amazon Singapore is set to create 200 more jobs as it expands with a new office at Asia Square. You're watching The Big Story. I'm Olivia Quay. You can subscribe to the Straits Times channel so you never miss a single episode. According to latest figures from last Sunday, more than 450 personnel from the Singapore Armed Forces have been roped in to help with the home recovery program. And so together with staff from other agencies, the program's team can now handle 95% of its incoming and outgoing calls. And also with this manpower boost, over 90% of cases eligible for home recovery are now contacted within 24 hours of them submitting their details. NTUC Health saying today that all 15 cases detected in its Jurong West nursing home cluster are residents. Sharing more on Facebook, NTUC Health also says no staff working in the wards tested positive so far, and the affected areas have been isolated. Testing is ongoing for the remaining 230 residents and staff on top of the regular surveillance testing. Experts have said such clusters at nursing homes and healthcare institutions where there are vulnerable groups remain a concern despite high vaccination rates. In view of the current ICU occupancy rates, the Health Ministry said last night it has been working with hospitals to set aside more ICU beds for COVID-19 patients. 100 more beds will be ready next week. Well, as at last night, there were 360 ICU beds in total. 146 are occupied by COVID-19 patients, with 67 critically ill and 79 under close monitoring. The current overall ICU utilization rate is 79.2%. Professor Dale Fisher is here. He's a senior consultant at NUH's Division of Infectious Diseases. Welcome back to the show, Prof. So 360 ICU beds as at yesterday. Another 100 will be ready next week. With the current wave, Prof, do you foresee that many COVID-19 patients will need intensive care?
Thanks, Olivia. It's really about managing the capacity. Of course, more people will go on forevermore needing intensive care for COVID and other reasons, but it's about the rate of increase. So if, for instance, 5 people come off a ventilator one day and 5 go on, then that's obviously stable. So, and I think that's what we've seen. We're seeing a lot, much more of a plateau effect compared to a month or 2 months ago when the numbers were clearly climbing because we were having so many extra cases. Now it's actually much flatter. I think there's very little chance that we'll see, the numbers jump by 20 very quickly. Not unless you did something almost reckless with all the restrictions. But by the same token, you're not going to see it suddenly fall by 20 because that'd need a lockdown and then wait 3 weeks. And of course, we don't need to do that and nobody wants that.
Exactly. Well, most days this month have had over 3,000 new cases. No, these are high numbers, but relatively stable. And if this continues, Prof, the reproduction rate will not get below 1, which is a key indicator of whether Singapore eases restrictions. But if we don't tighten measures further, which we actually haven't done since September, then how will the R rate be brought lower?
So we really need to think about the phases of a surge. So initially, you obviously see a steep climb, and then it plateaus off, and eventually it starts to come down. That's what happens. So just because we're sort of turning the corner, we're going onto that plateau, doesn't mean we're going to stay at the plateau over the next 1, 2, 4 weeks. I don't know. We will start to see that come down, and there are reasons for that. Partly there's less people to infect, so they've all got a lot more people have got natural immunity. Maybe people are being a bit more conservative in their exposures, and we know even though the rate of vaccination has slowed a lot, there are still people getting vaccinated and joining that sort of safe part of the community. So I think we will see it tail off because, as the minister said, surges don't last forever. Waves don't last forever. They will come off. Most importantly, though, the wave in the hospitals, it's still the 5 or 6% of the unvaccinated people. As you know, we're up at about 94% now of fully vaccinated eligible people. It's that very small number of unvaccinated that are still accounting for the lion's share of hospital utilization. So this is what, again, we need to keep focusing on. But it's also another reason why we will see this wave eventually come down, and with that, more easing of restrictions.
All right. Well, thank you very much for those perspectives, Professor. That was Professor Dale Fisher, a senior infectious diseases consultant at NUH. If you're looking to get a BTO flat in Singapore's prime and central locations, there are tighter buying and selling rules to follow under a new prime location public housing model. From January to September, 174 HDB flats sold for at least $1 million, raising eyebrows and setting off concerns about home affordability. And so, to keep upcoming prime locale flats affordable and inclusive, here are some of the new rules. The minimum occupation period will be extended to 10 years from the current 5 years for all other HDB flats. And even after this period is over, owners will not be allowed to rent out their entire flat, only spare rooms. In order to launch these prime flats at affordable prices at the BTO stage, HDB will provide additional subsidies on top of what's already in place for all BTO flats. But HDB will claw back the additional subsidies as a percentage of the resale price when the owner sells the unit. The subsidy recovery applies only to the first resale and not to subsequent transactions. And in the resale market, buyers must also meet the prevailing eligibility conditions, like having at least one applicant who's a Singapore citizen and a monthly household income not exceeding $14,000. They must also not own or have an interest in a private property and not sold any in the last 30 months. Well, for certain projects in prime locations, HDB may reduce the proportion of flats set aside for households who want to be near their parents or children under the Married Child Priority Scheme. These adjustments will depend on the specific location and attributes of each project. Well, remember, this PLH model will only apply to future HDBs in prime locations and not to existing flat owners. So let's focus on some of the new rules with journalist Michelle Ng. Welcome back to the show, Michelle. One new rule is that the minimum occupation period will be 10 years instead of 5 years for areas not in prime locations. Why the extension of the MOP?
So currently, the standard MOP is 5 years for both BTO and resale flats, right? But over the course of the years, we have seen a number of centrally located flats being sold at very high prices once they complete this 5-year MOP. You know, we are talking like $1 million in places like the Pinnacle at Duxton, which is a central area. But this new rule, this new extension of MOP to 10 years, which means that owners have to stay in their flats for at least 10 years, means that people will probably start thinking twice about getting these flats. So in a way, it may deter those who are hoping to buy these prime flats and flip it quickly after 5 years. Because now they'll be locked in for at least 10 years, which in my opinion is not a bad thing if you are genuinely interested to live in that very prime located flat. So another significant measure is the clawback of additional subsidies provided by HDB. So for example, the Rocher BTO that will be launched next year, if the buyers want to sell off their flats after they complete the 10-year MOP, they'll have to pay a percentage of their resale price back to HDB. This exact percentage we don't know yet. HDB will announce next month. But the main purpose of it is so that the additional subsidies given by the government doesn't just go into the owner's pocket. So this additional subsidies will be yours if you live there long term and don't sell the flat off. But if you do plan to resell the flat, then you got to return the subsidy to the government. So when these measures are taken together, essentially they make people think twice about the purpose of buying these flats. Because if you're buying it for your own stay, then it's perfect, right? It's great for you. But if you're buying it to make like a quick buck to flip for a profit, then these measures may deter you.
You know, say I own such a flat and I've lived in it for at least 10 years and now it's on the resale market and I want to sell. But the rules are also being tightened on who can buy these PLH flats on the resale market. For instance, the household income of a buyer cannot exceed $14,000. So Michelle, what is HDB intending to achieve with this rule?
So the purpose of having an income ceiling cap is mainly to limit the pool of buyers who can buy these resale flats. Same goes for having at least one applicant who is a Singaporean, and you also cannot own any private property or sold off any private property in the last 30 months. So basically, if you qualify to buy a BTO flat currently, then you can also buy these resale flats under the PLH model. So all these rules are meant to reduce the pool of resale buyers. So not everyone will be able to buy them. Certainly not someone who earns, say, like 20K a month. But the majority of the average Singaporean household will qualify.
These measures are aimed at keeping these prime location flats affordable and inclusive. I understand, I understand the appeal. Living in a central location can be very convenient, but the heartlands have so many amenities these days. So who are the people, I'm wondering, buying flats in these prime or central locations, Michelle?
Well, actually, HDB doesn't provide the specific breakdowns of who are buying these flats, but agents on the ground tell us that there are quite a variety of people. So mainly they can be like private property downgraders, say retired couples, and all their adult children have left the nest, so to speak, and they don't need like a big landed house anymore, but they still want to live in a central location. So this sort of like prime central location HDB is quite attractive to them. Or they could be families in their 30s and their 40s who are financially stable, or they could even be your young couple, 20 something, who value a central location or are earning a significant amount, or they have financial support from their parents. So actually there's like a wide range of people, but I think it's safe to say that many Singaporeans still see value in living centrally, and some will do so if they have the means to afford it.
Well, very interesting points, Michelle. Thank you so much for sharing them on today's show. That was my colleague at the Straits Times, journalist Michelle Ng. Well, the first BTO project under the PLH model is in Rocha and will be launched next month. Located on 2 plots along Veld Road and Kelantan Road with Jalan Besar MRT station at its doorstep, this project will have 963 and 4-room units as well as 42-room rental flats. Moving forward, HDB will launch at least one prime location project per year. In other news, Amazon Singapore is set to create 200 more jobs by end 2022 as it scales up its presence here through a new office spanning 3 floors at Asia Square. Occupying over 100,000 square feet, it will house over 30 teams and up to 700 employees from its consumer business and corporate functions. And with 100 days to the Beijing Winter Olympics, organizers saying today that protecting the Games from Covid-19 is the biggest challenge. And so it will impose strict measures, including having all participants take daily tests and banning international spectators. Beijing is currently experiencing its worst outbreak in more than 8 months, reporting about 20 infections so far in the latest flare-up. Well, those are our top stories for today. For more news and videos, visit straitstimes.com and subscribe to our YouTube channel by hitting the red button below. I'm Olivia Quay. See you tomorrow on The Big Story.